Today it's my pleasure to talk to you about common gastrointestinal and liver and nutritional disorders. During this conference, we're going to cover several of these topics. Let's just start by talking about ingestion of foreign bodies. As you know, children in the growing age of around 4 years and above, they start exploring the environment around them, and sometimes, unfortunately, they end up putting things in their mouth they should not. For example, we'll talk today about ingestion of coins, for example. It's very common for children to play with coins, and sometimes they swallow it, and that can get stuck in the esophagus. Usually this happens all of a sudden, typically sometime late in the afternoon or at night, and the child will come sometimes without even witnessing the event. He comes with crying, feeling difficult to swallow, with excessive drooling. The parents usually, they don't know what happened, and they rush him to the emergency room, and then the doctor, if he does an x-ray, he will find there is a coin stuck in the esophagus or in the stomach, causing all these problems. Coins in general, although it's very disturbing, actually they are less dangerous than other foreign bodies. The more dangerous ones are, for example, the batteries, the disk batteries, the batteries you use for your watch or for the remote control. Unfortunately, batteries are very, very, very dangerous. I cannot stress that any more than this because of a couple of things. First of all, we know in the esophagus or in the stomach, it's a wet environment, and there will be a current going from the positive to the negative poles of the battery, causing electrical burn. And unfortunately, it can perforate, i.e. making a hole in the esophagus within few hours after ingestion, with a very devastating outcome. So I really recommend to the parents to be very careful, of course, watching their children throughout, but not to keep any batteries anywhere loose in the house, because it's very easy for a child to put it in his mouth and swallow it, and again with very unfortunate outcome. The other serious problem I'd like to talk to you about is ingestion of material, cleaning materials. Children, they crawl, they go to the cabinet in the bathroom or the kitchen, they found something, usually looks in a nice bottle, and they start drinking it. This can be typically an alkaline, sometimes an acid, but both of these can cause actually serious burns to the esophagus, and sometimes even again forming a hole or a perforation in the esophagus with undesired outcome. So please, I recommend to the families, keep all the cleaning material away and locked from children, or in a higher cabinet that the child cannot drink it. If this happens at home, please don't give the child anything. Rush him to the emergency room where he can be managed. Some parents, I found them, they give them water or milk. Sometimes actually this can hurt the child more, because when the milk or the water reaches the stomach and reacts with this alkaline material, it can cause even worse burn by producing some heat, and sometimes the child might vomit again. So it burns in the way in, and it will burn in the way out. In such cases, please just take the child to the emergency room without giving them anything, and let the pediatric expertise in the emergency room handle these patients. We also recommend to have them child-proof, like the cover of the bottle is locked and cannot be opened unless it's used by an adult. We at Sheikh Khalifa Medical City and other centers in UAE, we have the expertise to handle these patients. Many of them, they're going to require endoscopy to see if there is any burn and the degree of burn, and treat it accordingly. Also, during our conference today and tomorrow, we're going to talk about advances in the diagnosis of gastrointestinal disorders in general. The use of endoscopy with biopsies is actually have added a lot of value to diagnosing these children with difficult and complicated problems. For example, children who are not growing very well, or have recurrent abdominal pains or vomiting or diarrhea or so forth. We have the capability to scope them. Where endoscopy means actually the child will be anesthetized, or at least deeply sedated. The scope is like a flexible tube that goes through the mouth, or we can do it from below through the anal opening, and we advance the scope. The scope has a specialized camera, and we are seeing what's inside the intestine, and we take biopsies. Biopsies are actually little samples we take from there. The procedure usually usually is very well tolerated without any serious side effects. The total time of the procedure is about 30 to 60 minutes in most cases, and after that the child will be awakened, and actually most of the times he can go home in the same day. The biopsies, or these small samples we take, we look for these in details under the microscope, and we can diagnose several kinds of disorders causing again the symptoms of pain, vomiting, poor weight gain, and so on and so forth. These modalities in diagnosis have added a lot to these patients and can make the diagnosis easier, and later on, of course, the treatment will be managed accordingly. So what are the challenges we face? Well, there are several challenges. I think the biggest two I would talk about today is sometimes the late referral. The patient has been suffering for a while and they did not reach the appropriate physician. We always recommend an early referral when there is a concern about some serious gastrointestinal problem. The earlier the referral, the faster the diagnosis can be reached and the treatment can be started earlier without having the possible complications of this. So please talk to your pediatrician early on when you have concerns, and then start the process of investigation and diagnosing these patients. This brings us to the importance of today's conference. This conference is all about sharing the experience, and we have an international panel of speakers who come from all over the world to discuss important topics when it comes to gastrointestinal and other disorders. Hopefully with such an international pediatric conference, we can raise the awareness of the physicians to be aware of the new modalities in diagnosis, the new treatment approaches that we have, so we can provide a better care for the new generation of UAE.